Welcome to Conversations on Healthcare. This week we welcome Congresswoman Rosa DeLauro on voting rights, Build Back Better, and what the infrastructure rescue will bring. Now here's Mark Masselli and Margaret Flinter.
There's not one American during the past 2 years of the pandemic who hasn't been affected by the leadership and decisions made by our next guest. She's the chair of the Appropriations Committee of the United States House of Representatives. It holds the power of the purse. Her policy making has meant we've had the resources needed to face COVID-19, the biggest economic and health crisis in our country's history.
Representative DeLauro's leadership has resulted in Congress passing the largest governmental response the country has ever seen to rescue individuals, the economy, and the healthcare system. But we know her first as our local member of the House and a passionate advocate for community health.
Congresswoman, thank you for joining us again. And right when your insights are really needed, let's start with asking you to share with us the latest details about the spread of the Omicron variant and the responses that have come from both the House and the Senate and the Biden administration.
Mm-hmm. Well, first of all, I'm delighted to be with the two of you, with Mark and Margaret, and thank you. And all I can just say is just thank you so much for what you do at Community Health Center, what you've been doing now, what you've done in the past. And I treasure the working relationship that we have had over the years. You all have been in the vanguard of making sure that whatever the crisis is, that you are ahead of it and on top of it. And that really is, that's really extraordinary. So we're very, very fortunate to have you and the health center and the work that you do statewide for all of us. My God, I can go back to work in opioids and all of the, you know, and just general health care, because you and I both know that it's the health centers where we're looking at primary care for over 23 million people in this country. So thank you very, very much for that. You know, it is, I have to step back a second because when I go back to the American Rescue Plan, or even before that, to the CARES plan, to as soon as the pandemic hit, what we tried to do at every step of the way was to be able to use federal resources in order to address which was the most significant economic and health crisis that we faced in a generation. And that has been the focus. And what we did in CARES 1, CARES 2, the American Heroes Bill, and then starting and last year with the American Rescue Plan was to provide the necessary funding so that we could look at research, we could look at vaccine development, we could look at therapeutics, and how we were going to begin to distribute testing. And we know the problems that we had early on with testing, PPE, and all of those. So the effort to try to overcome all of that. And if I look at, and at that juncture, to be very honest with you, we were working in areas where we had bipartisan cooperation with these bills, a significant amount of federal resources, again, to address the efforts. With the American Rescue Plan, that was $1.9 trillion. And again, looking at what we needed to do about making sure that we had the wherewithal to get vaccines distributed, shots in the arm for people, setting up the kinds of clinics, the kinds of things that you all did, mobile clinics, the places where people could really get access to what they needed. In addition, the amount of economic support that went out at that time was incredible for businesses who could not have survived without the help. Hospitals, healthcare centers. We were there, and this is the proper role of government. When there was a great article many years ago by a reporter named Michael Ignatieff and he was writing about the Katrina, and he said the government is a covenant with the citizens of this country, and that we have an obligation that when the challenges are so overwhelming, that government steps in. And he said this, and I don't forget it. He said, when the levees broke in Louisiana, that covenant was broken, and we needed to have the full force of the federal government. Well, when this crisis began, the levees broke. People could not handle all of this on their own. So the federal government stepped in to do what was necessary. One of the things that was so critically important to me in terms of the health piece was the child tax credit in the American Rescue Plan. And look, you are very concerned about children and their health. And it is the child tax credit that I believe was addressing the issues of poverty. And you know to a fare thee well how poverty affects children. Mm-hmm. You know, whether it is the food, or their nutrition, their education, their health, their future, what happens in their homes, you know, and so that the child tax credit, I believe, has met the need, and we got to continue to fight for it to be extended. But whether it was, and we've seen already that 50% of kids being lifted out of poverty in November, 3.8 million kids. The hunger numbers have declined. So that all of this is so critically important. And we look at that. Then you look at Build Back Better, which we are trying to get over the finish line with the kinds of resources that are necessary for healthcare. The president just a week ago setting up sites in schools where we can test, and so we can keep kids in school. It's it's critical that we do that. But the Build Back Better expands Medicare benefits. It reduces drug costs. It will provide, I believe it's $1.8 billion. We're doing this in appropriations, providing $1.8 billion to community health centers, $50 million to support school-based clinics. If I think about it and you catalog, reaching back, you know, as the pandemic started to now, that look at the way we have almost doubled, tripled the federal resources to address the issue, trying to create a public health care system with the infrastructure that it needs. We knew that collapsed during the beginning part of the pandemic, and that we, in appropriations bills, I'm looking at how we buttress the public health infrastructure system. That has to do with you. It has to do with the modernization of data. It has to do with our laboratories, making sure that they're strong around the state and around the country. So we're looking at billions of dollars in this case. So whether it was the beginning, whether it was Delta, and now Omicron, there is the full force of federal resources to try to address this healthcare crisis and the accompanying economic crisis with it. I know I went on at great length.
That's great.
But there has been an extraordinary amount of work that's been done, and oftentimes the word isn't getting out about all that is in. It has gone out, and that's in the pipeline to go out.
Well, Congresswoman, you have touched on so many things that we have been so eager to talk with you about, and we're going to pick up on a number of them. And thank you. Thank you for your kind words about our community health center. But as you know so well, there are 1,400 community health centers in the United States serving millions of people across the country. And you are the co-chair of the House Community Health Center Caucus.
Right.
So you know very well the research, and I know your colleagues in the Congress are interested in evidence. You know the research that community health centers save the federal government money in the long run through prevention, through primary care, through managing complex illnesses, dental care, behavioral health, and all of this ultimately helps to save money for the federal government and improve health in the United States overall. How can we help more of your colleagues actually learn about and understand this return on the investment, why it's so important in the United States, and still too many people in the country that don't have easy access to a community health center?
Right. I think you've hit on something. I can recall, I think you will recall, we had a session in Middletown, and we had the stories of people who came and talked about how the community health center changed their lives, what it did for them. I'll never forget that. Story after story after story. It is making sure that, and I will say this, though, there is a really a support in the Congress for the community health centers. I think people have begun to understand what it is that you do, and that you are the primary care for so many millions of people in this country. And so that it is, I believe it is the stories that people can tell, that they can get to their members of Congress to talk about how the centers have been pivotal in their lives and the lives of their families, and making sure they have the counseling, the dental care, as you pointed out, the physical, care, the problems that people have faced with opioids in our communities, and that the community health centers have been pivotal in that area. Again, I remember the session that we had again at the center with families came up and spoke about the issues and the kind of help that healthcare centers could provide. We often think sometimes we live in a bubble where we think everybody knows what's being done, how it's being done, how it's focused on people's needs. And that's not true. People don't. And what we need to do is to look at what are the wraparound services. And you can tell me, what do people need to do? How are we doing in rural parts of America? Do we need more in the area of transportation that gets people to these efforts? What kind of services do people need in order to take full advantage of the services that you can provide? I think that's so critical. We need to build on the experience that you have, and how do we make it better? I say this about the child tax credit, and then I'll be quiet and I'll let you guys. I haven't seen the program work as well as the child tax credit. From January, it was in the American Rescue Plan. March, we voted on it. July, the monthly payments started going on. Nobody believed we could do it monthly. By the end of December, November, 3.8 million kids lifted out of poverty. Hunger numbers decreased. And now I say this is a similar parallel for the community health centers. This is a success story. So where are we building on this success? What are we doing? What should we be doing to ensure that you can do what you're doing, but expand what you're doing for families? In the same way I feel about the child tax credit. How do we build on this success?
Well, you not only...
I'm open. Yeah, I'm open to ideas.
You not only feel about it, but for 20 years, you have been a lone voice in the wilderness many times, talking about the child tax credits. And so this is just such an important thing. And I know it probably pains you when you hear critics saying that parents might be wasting these dollars. It's really been one of the evidence-based policy-making efforts that you have led the charge on. And I just wanted to state that. I also, though, want to hear your thoughts about the Build Back Better Act and whether or not there's going to be a compromise. The tax credit's a good example of that. There's a lot of guy along. Give us some sense of where we are on trying to get this agreement between the concord between the House and Senate and get this thing moving forward.
Mm-hmm. That's a good word, Mark, concord. I believe, and I'm not Pollyanna, you know that I've been around public policy and politics for a very long time. I believe that there is if you will, a deal to be had. I think we are going to work through a way in which we have a Build Back Better piece of legislation. As you know, the House is there on this. We have been there from the outset. We have some stumbling blocks in the Senate. I think we need to work those through. I think we need to take a look at, and I have been consistent on this from the outset. It may not be that we can do everything that was intended to get done in terms of Build Back Better, the original, piece of legislation. But how do we look at what is most immediate for us to be able to tackle? How can we put in place the kinds of structures that are necessary to address these particular issues? I know that the myriad of health issues and building on the Affordable Care Act, looking at how we can expand Medicare benefits to including hearing aids. How do we deal with closing that Medicaid gap for people? The kinds of services for seniors, loved ones who are disabled, and how these services can become accessible. I include in this a child tax credit, which, as I said, makes sense in terms of the success of the program. And I think with regard to the Affordable Care Act, now that we're talking about, people only having to pay 8.5% of their income, for premiums. Healthcare is one of the biggest issues that people face today. They want relief. We need to bring down the costs of the prescription drugs. Capping the cost of insulin is a very high priority. So we ought to take a look at what we can do, again, in building on structures that are there, which we can add to, and trying to look at how we deal with health outcomes. And I would just say, as I mentioned before, the public health infrastructure. I think we have to, there were a lot of systems that collapsed in the early days of the pandemic. Our unemployment system crashed. It couldn't handle everything that it was doing. But I think we have to think about the public health infrastructure, which really collapsed on us. And we cannot let that happen. And that's why, again, that it's imperative. So let's pick and choose the areas within Build Back Better that can have immediate effect on people's lives, can have an immediate health impact on people's lives, an immediate economic impact on people's lives. And let's try to move forward with that. Right. That's where I think we need to go. I think we can get to a conclusion on this and get it across the finish line. And I'm going to fight like hell to get that done.
We know you are, and we thank you for that. And I want to go back to something you said about the early days of the pandemic, right? 2020 kind of hit us like a brick wall. None of us had ever seen anything like this. We'll never forget, right? And one of the things a generation of people, I think, got introduced to was this concept of stimulus relief. And people saw the government step forward on a personal level and on a business level to keep things going until we could right size again. And we all thought I thought we'd be long past it by now, but here we are. And I think the question to you is somebody so concerned with businesses. You live in a very dynamic city, lots of small businesses as well as major players. Will there be another round of stimulus relief? Do you believe that the restaurant industry needs stimulus relief at this point?
Right. No, you've hit on something that is prescient. It's now. And look, there is talk. There's nothing tangible at the moment, but there is talk about another COVID relief package, a supplemental package. First of all, let me step back. I don't want, people need to understand the appropriations process as well. And look, the $1.9 trillion, 1.1 billion dollars that we did for the infrastructure. And by the way, the infrastructure bill has health pieces in it as well, in terms of construction and facilities, et cetera. So not to be left behind. Build Back Better, but all of which we need to be doing. But the money in Build Back Better would be over a 10-year period of time. I want you to think about appropriation. Appropriations is $1.5 trillion every single year. So, which is why I am trying to be as aggressive as I can in getting the omnibus appropriations bill passed, because there is so much in there. I mentioned the 1.8 for community health centers, the money for school-based health centers, the money for the workforce, a public health workforce, and the training there. So we cannot forget that and the importance of moving forward on that issue. There's money for the CDC in there. There's money for NIH. All of these things are in the appropriations bill. Now, I believe that there will be another COVID supplemental bill, and that will take into consideration both the health issues and the economic issues, Margaret, as you pointed out. Yes, relief for restaurants. I don't know if there would be more relief for hospitals. Don't know yet, because we haven't, the package is not formulated yet. But I will just tell you this: wherever I went in the district, after the rescue plan and the earlier plans as well, I haven't heard this in years from people. Thank you to the federal government. Without the federal government, we couldn't have kept our restaurant open. We couldn't keep our business open. Our hospital was going to crash. Our school system wasn't going to make it. A childcare industry was going to fall flat on its face here. So when is the last time you've heard people say thank you to the federal government? And it's usually, you're irrelevant in our lives. And I think that people have now understood that there is that role for the federal government. And we need to foster and let people continue to believe that with what else that we are trying to do as well. So yes, I believe there will be another COVID relief supplemental package, and we will address the economic issues of businesses and of restaurants and others, including vaccines. And probably, some people don't think that this is an important issue, but internationally, we need to not only donate, be a donor in terms of vaccines to other countries, we need to help to provide the delivery mechanisms that get shots in the arm of people, because the pandemic doesn't know boundaries. If we're not safe internationally, then we're not safe in the United States.
Well, it's a great point, and also just highlighting the agreement that happened on the historic infrastructure bill, and that the role that got played by leaders. And I'm just thinking a little bit about the Speaker of the House, Nancy Pelosi, and I'm wondering if you can. She still has time. She said she's going to do this one more term, but talk a little bit about her legacy, because it requires enormous leadership to get these things done. Obviously, you're part of that leadership, but talk to us a little bit about Speaker Pelosi.
Our speaker, and I think you all know who she is and what she's done. And this is not just in the face of a pandemic. There would not be an Affordable Care Act without Speaker Pelosi. I was there. I was in the room when there was the willingness to break it up and do this piece or that piece and so forth. She said, no, it goes together. And one of the biggest issues was over women's health and what we saw there. But her leadership in this area is really extraordinary. Her leadership on the infrastructure bill that we just passed, or where she's come throughout this pandemic, in both the economic pieces and the healthcare pieces. I characterize her, she has a spine of steel. She really doesn't get, she looks for the way to build consensus to get it done. And that is carrot and stick. She can be as tough as nails, but she is pragmatic. She understands and knows that when you have to step in, you have to compromise so that you get as much as you can get. You just don't take the ball and go home. That is not optional. We have got to make good on these, in terms of delivery for the American people. That's who she is, and it doesn't come from. It comes from her own set of values, Margaret and Mark. It really does. She has been engaged and involved from a family who understands the power of government to do good. And public service is, it's in her DNA. And so she knows that the power of the federal government and how it can work to benefit to the good, the benefit to people in this country. And she's made it work over and over and over and over again.
Well, Congresswoman, you've referenced women's health just a moment ago there. And of course, this is something you've long been associated as a key issue of concern. And we have a feeling where reproductive rights hang in the balance somewhat, but you've taken some proactive steps by introducing the Women's Health Protection Act, along with others.
Right.
Tell our audience more about this legislation. Where does it stand right now?
Mm-hmm. Well, I believe that the Senate is going to take up a vote on the Women's Health Protection Act within the next week or 10 days. And so it's overwhelming support in the House. And in essence, it codifies Roe v. Wade. And it just allows women to get the kind of health care that they need and to make the decisions that they need to make about their health going forward. It's overwhelming support in the House for it. And, look, I think it's tougher in the Senate. And, to be very honest, one of the things that we face, there's a 3 or 4 vote margin in the House of Representatives today. And it's even in the Senate. So that makes it difficult. But I think on some of these issues, we can count on some of the Republican members, the Susan Collins, the Lisa Murkowskis, et cetera, who understand the weight of this issue. But it is all about making sure that women have the access that they need for the health care that they need, and that women's health is put front and center, and it is not on a back burner. And that requires us to really look at how Roe gets codified. And we know the barriers that have sprung up all over the country and with the Supreme Court. Not unaware of that, but what we can't do is to get deterred. We can't get stopped. We just have to keep going and use this time. Time changes the environment, the people who are in charge, and so forth. And that makes a difference in where we come out for the future. So we need to get, and I say this to people around the country, we need to get to folks in the Senate to talk about passing the Women's Health Protection Act so that women's health needs to be where it be, as on par with men's health in this country, which is something that the Affordable Care Act started doing for the first time in the country's history.
Well, thank you, Congresswoman, for your time. Congresswoman Rosa DeLauro was first elected in 1990, has since then served as a representative from Connecticut's 3rd Congressional District. Her website, DeLauro.house.gov, and you'll find her on Twitter at Rosa DeLauro, all in one word. Thank you again for your leadership, for your inspiration, and for joining us today on Conversations on Healthcare.
I'm so delighted to join both of you, and it's lovely to see you. I miss seeing you.
We miss hugging you.
I know that's it. There's one last point I would make. When you take a look at the American Rescue Plan, if you take a look at the infrastructure bill and the potential of Build Back Better, this is, I think people don't understand. the paradigm shift in federal resources. For decades, the federal resources have gone to the richest 1/10 of 1% of people in this country, to the richest corporations, many of whom do not pay any taxes. That is now a shift where we are making investments in families, in children, in their health, in their economic wherewithal. And that in and of itself is a change that the federal government has undertaken over this last year. So all to the good. Thank you for what you do. We're going to make sure you get every damn dollar that we can at the federal level in order to allow you to continue your great work. Thank you.
Thanks so much.
Thank you,
Take care.
Congresswoman. So
Take
good
care.
to see you.
Okay.
Bye-bye.
Bye. Be well.
Thank you.